Hello everybody, this is Dr. Kukreja A. Kalani. I am a practicing homeopath and I have been practicing since last 25 years at in Mumbai, that is in Powai. And today I'll be talking in detail about what are the respiratory allergies and what are the chronic respiratory infections and diseases, what are their causes and symptoms, and what is the treatment of the same in homeopathy. So let's talk about the respiratory allergies first. So what are the cause of respiratory allergies? They are triggered by an immune response to a specific allergen such as a pollen, dust mites, or some other certain pollutants. The symptoms involve basically nasal congestion, runny nose, sneezing, watery eyes, and coughing and wheezing. So symptoms usually start after an exposure to the allergen and can vary in the severity depending upon the individual sensitivity. So the management involves avoidance of the allergen as far as possible. Next, what are the respiratory infections? They are caused by pathogens such as viruses, bacteria, fungi. They invade the respiratory system, leading to inflammation and symptoms. The symptoms include coughing, fever, sore throat, runny nose, and they can vary in the intensity. The onset is basically depending upon the exposure to the infectious agent and may worsen if left untreated. The management treatment depends upon the cause of infection and may include medications and supportive care, rest, fluids, and sometimes hospitalization in severe cases. And third is the respiratory diseases. So they can vary, including infections, environmental factors, genetic predisposition, or the lifestyle choices. The symptoms, are recurring, and they are like shortness of breath, coughing, wheezing, chest pain, or difficulty in breathing. The management includes medication, oxygen therapy, lifestyle modification, pulmonary rehabilitation, and sometimes surgery or any other interventions. In summary, the respiratory allergies are immune responses to specific allergens. And now let's talk about in detail about the respiratory allergies, infection and diseases. The respiratory allergies are also known as allergic rhinitis, hay fever, occur when the immune system overreacts to allergens in the air. The symptoms of respiratory allergies are sneezing, runny nose, stuffy nose, nasal congestion, postnasal drip, fatigue, and headache. Respiratory allergies can be seasonal, triggered by specific allergen present at certain times of the year. The management of respiratory allergies typically involves avoiding allergens whenever possible, using medicines to reduce the symptoms and control the inflammation. It's essential for individuals with respiratory allergies to work closely with the healthcare professional to develop an effective management plan to avoid the specific triggers and to deal with the symptoms. So what is the common so now we come to the respiratory infections, and they are the illnesses that affect the respiratory system, including the nose, throat, airways, and lungs. So the common respiratory infections include common cold caused by viruses, rhinovirus, coronavirus, or adenovirus, and the symptoms are like sneezing, runny nose, or a stuffy nose, sore throat. Next is the influenza or the flu caused by the influenza virus. The flu can cause symptoms similar as above, and includes high fever, body aches, chills, and fatigues. Next is bronchitis, that's the inflammation of the bronchial tubes caused by viruses like the influenza or rhinovirus. So symptoms include coughing, chest discomfort, and production of mucus. Next is pneumonia. That's the infection of the lungs caused by bacteria like streptococci pneumonia or viruses like influenza or respiratory syncytial virus, that is the RSV. The symptoms include fever, cough, difficulty in breathing, chest pain. In severe cases, we have confusion of bluish skin color. Next is the sinusitis, that is the inflammation of the sinuses triggered by the viral infection or allergies. Includes facial pain, headache, postnasal drip. Next is the strep throat, that is caused by the bacterial streptococci pyrogens. Symptoms are like sore throat, difficulty swallowing, swollen lymph nodes. The treatment of respiratory infection varies depending on the cause and the severity of the problem. So, respiratory diseases are conditions. Now, we talk about the respiratory diseases. They are the conditions that affect the respiratory system, which includes airways, lungs, and other structures involved in breathing. These diseases can range from acute infections to chronic conditions. So, some common respiratory diseases include COPD, that's a chronic obstructive pulmonary disease, a group of progressive lung diseases including chronic bronchitis, emphysema, and especially it involves the airflow obstruction, breathing difficulties. The COPD is often caused by long-term exposure to irritants such as cigarette smoke, air pollution, or occupational hazards such as exposure to the dust and the chemicals. Next is the asthma. Asthma, a chronic inflammatory condition of the airway that can cause recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing, particularly at night or early in the morning. And next is pneumonia. So it can be caused by bacteria, viruses, fungi, or other pathogens. So we have described pneumonia earlier. It can range from mild to severe depending upon the vulnerability of the patient. Next is the ILD, that is the interstitial lung disease, a group of disorder characterized by inflammation and scarring of the lung tissue, leading to impaired oxygen exchange. So this may include idiopathic pulmonary fibrosis, sarcoidosis, and hypersensitive pneumonitis. Next is the lung cancer, a malignant tumor that starts in the lungs and can spread to other parts of the body. Smoking is the leading cause of lung cancer, and the non-smokers can also develop this disease due to exposure of secondhand smoke or exposure to the asbestos, radon, or other carcinogens. Next is the sleep apnea problem, the obstructive sleep apnea, a sleep disorder characterized by repetition episodes of partial or complete obstruction of upper airway during sleep, leading to difficulty in breathing, pauses, and disrupted sleep patterns. Next is the cystic fibrosis, a genetic disorder that affects the respiratory and digestive system, causing thick, sticky mucus to build up in the lungs and other organs. This can lead to repeated lung infections and breathing difficulties and poor growth and digestive problems. Next is tuberculosis, an infectious disease caused by the bacterium Mycobacterium tuberculosis. Primarily affects the lungs but can involve other organs too. So basically symptoms involve fever, weight loss, night sweats, and it can spread through via respiratory droplets. So these are a few examples of respiratory diseases, and the early diagnosis and appropriate medical care essential for managing the respiratory diseases so as to improve the outcomes and their prognosis. So the role of homeopathy in treating the respiratory allergies, chronic infections, and the chronic diseases. Homeopathy works best in respiratory complaints by working on the allergies and the hypersensitive response of the patient to the surrounding environment. Continuity of homeopathic treatment not only helps in reducing the allergies but also improves the lung capacity by preventing frequent relapses of infection. Why allergies in children should be treated with homeopathy? We come across so many children and infants who suffer from several allergies. So, what is the reason for the allergy? At a young age, when you are not exposed to the trigger factors, the allergies surface because of the hereditary influence, the low immune or a defense activity. It is the individual's way of developing immunity so as to wear out the hereditary effect on their system. So, what should be the approach towards treating such ailments? It's basically a holistic constitutional medicine which will help support and fight the invasion by improving the defense mechanism. So, what is the role of constitutional prescription in homeopathy? This refers to the selection of homeopathic medicine which aims at correcting the inherent predisposition to the disease. It not only covers the genetic makeup or physical and mind symptoms, thermal state, desires, aversions of the mind and the body, And the main query remain, how does the constitutional prescription works? So that is very important to know, that how does a constitutional prescription works in homeopathy. These are a few points which will help answer this question. Medicines act as immunoregulator and molds the immune response to fight off the repeated attacks by the microbes. Homeopathy believes that microbes are just the trigger, not the causative factor. The real problem lies with the low immunity, which invites repeated infection. So, one very important role of constitutional treatment is that it helps in absorption and assimilation of essential nutrition, that helps in maintaining healthy state of the body. The treatment also helps in neutralizing the free radical, thus it acts as an antioxidative agent to stop the disease process. So what do we achieve or aim towards post-treatment with constitutional medicine? The intensity and flare-ups of acute attacks reduce. Children do get cold and cough, but the intensity of the illness reduces, and also the repetition of attacks is less. Most important thing is to help minimize the tendencies towards the illness and help them to wear out the genetic influences. So this is how homeopathy definitely very beneficial in treating the cold allergies and repeated infections because of allergies, and finally the chronic respiratory diseases also can be very well managed with homeopathic medicines. So I believe I've briefed you up regarding the symptoms and the types of the respiratory illnesses, and the role of homeopathy, especially in tackling these allergies. This is Dr. Kukreja A. Kalani signing off. Thank you.